health equity using their personal stories. Next slide. This webinar is being presented to you by People Power Health. Our goal is to build a learning community of healthcare professionals to help effectively organize and respond to our patients and community. Let me introduce you to our Executive Director and Lead Trainer, Pedro Stoychik, Trainer and Project Manager, Sam Gonzalez, our Admin and Technical Guru, Nevin Abasic, and again, myself, Brian Archie, Trainer and Community Manager. Next slide. Just as a welcome, we do encourage any questions to be placed in the chat, or for you to please use your raise hand feature so that we can call you into the room. When you are not speaking, if you would please just keep the mic on mute so that we are not getting in any background noise. And to the best of your ability, if at all possible, we know there are technical issues. If you can keep your camera on, that would be fantastic. And again, Sam will be our chat monitor and Nevina will be moving us for tech support. Next slide. Just before we go through our acknowledgement here, I want to make sure we begin all of our meetings with a check-in question. And just to bring a little engagement into the room, if you were a flavor of ice cream, if you would drop that in the chat for us, what would that be? I'm almost thinking, here we go, vanilla. Pistachio, chocolate, vanilla. Okay. Strawberry. Thank you, thank you. Before we begin, we just would like to make an acknowledgement that while there are many avenues to learning the art of organizing and leadership, our core training pedagogy is based upon community organizing methods developed by Professor Marshall Gans at Harvard Kennedy School. For those that don't know Marshall, he has over 30 years of experience in organizing with Cesar Chavez, with the Farmers Movement, and he was active in the Mississippi Summer Project in 1968, summer bus boycotts. Next slide. So our agenda, which is short, so we should have you here for roughly about 45 minutes, just a welcome to the community. We'll have an overview of what our programming is all about. Why is storytelling a tool for leadership? We will watch and debrief after that a short video, public narrative by Amy Staley. There will be an invite into the community, and this is just for us to have an opportunity to practice and ride the bike, if you will. And then a closing and call to action. And next slide. I would like to turn it over to Peja to discuss with you the basis of HEART and why healthcare professionals can also be organizers. Peja?
Thank you, Björn, and welcome everybody. So my name is, as Brian said, my name is Pedro Stoychik, and I'm an executive director of People Power Health. Aside from the webinar series that we are doing today, next Tuesday, and then the Tuesday after, we also want to introduce the health activism and reflection training that we're going to launch in the fall. That is actually a little bit more than just a training, because it's an initiative with an aim to increase clinician-led activism and community organizing efforts to advance health equity and justice. And the curriculum that we created for HEART, for the health activism and reflection training, is there to address like couple of things that we faced as clinicians. I'm a clinician myself. I'm a physician, and our current healthcare system, the way it is organized, is in many cases making us feel powerless and divided into our own organizational spaces, into our own kind of divided places where we cannot bring our full selves into it. And I felt that multiple times through my career, and I know I've heard that from a lot of clinicians around the country. That is one of the biggest challenges to their activism, is that they are not allowed to actually do stuff, nor bring their full values and practices and stories and inspiration into their professional spaces. The second thing is that as much as our medical training is good, we don't get the training how to address some of the structural problems that we face, especially the problems that are happening in the community. So we are trained really well to address medical issues of our patients, but when it comes to social issues that they face, we don't get an official training how to do that. And community organizing and activism can teach us that. And we are building this community and this initiative to address some of those things. And then finally, last but not the least, that the way activism is practiced in most cases is this lone wolf style of advocacy. We call it a lone wolf because it's a you do it alone. It's expected for you as a doctor, as a nurse, as a social worker to do most of the work of advocating for your communities and for your patients by yourself. And we're trying to challenge that and really bring a new way of doing things, which requires building a community around you, engaging other people, and feeling less lonely, and therefore hopefully address some of the issues like burnout and disengagement that happens to many people who are in this space of health advocacy and activism. So this is the beginning of our journey in many ways, and we're going to send you more information and more details about the health activism and reflection training coming in the fall. But for now, I think you're going to get a preview of one particular practice, like storytelling, that Brian is going to introduce, that we cover in more details during the training and this program. So back to you, Brian, and thank you.
Thank you, Pedja. Next slide. So intro to public narrative and story of self. And I just want to call out into the community that's here today. So we've all heard stories, growing up. And I just wonder, can you recall a story that you heard that affected you? And you can feel free to answer in the chat or come off mute. I'm wondering maybe if you can identify any moments that might have stood out to you when you heard that story. No? Okay. Next slide. So let's jump into maybe what public narrative or storytelling is not. So to start off, public narrative or storytelling is not a resume or list of accomplishments. While these things are very important to us as individuals, they don't really speak to who we are to others. Your public narrative is not a speech or proclamation. And I know we've all heard some of these at things like city council meetings or in the town square. And public narrative is also not a logical explanation of an abstract idea or thought, meaning it doesn't allow us the means to really think our way through what's going on. Next slide. So when we look into what public narrative is, overall public narrative is an emotional explanation of the things you care about or values shared in a meaningful way to elicit action from others. It is a core leadership practice of community organizing grounded in social movements. It allows us a way of telling our story to really build and connect capacity with community or our constituency. And public narrative also helps us provide or find hope while encouraging others to do the same and understand our why in the moment. So meaning really that public narrative is an intentional way for community building and health activism. Next slide. So when we talk about two ways of knowing, right? So we as humans view the world in two different ways. One is the knowing with the head, and that is the strategies, and that's the how to do it. And the other part of that is knowing with the heart, right? And then we find that through stories. the why we do the things as we do. As healthcare professionals, we use logic or if and then moments to understand the world. The other way of learning that we really want to hone in on is through the emotions that we get from the stories that we tell or that we hear. These together help us to better, again, the head and the heart, help us to better understand each other and move in more towards a means of action to get the outcomes that we are looking to have in community or within our organizations. Next slide. So storytelling is a leadership practice. And the definition of leadership as we understand it is accepting responsibility for others to achieve a shared purpose in the face of uncertainty. But how do we get there? How do we understand that? And we do that through telling our stories, right? And allowing people to see and understand our values, again, to grab hold of those emotional strings that connect us, and hopefully again move people into a place of where they're ready to do something about it. Next slide, please. So as we think about stories we've heard growing up, now every story that we have encountered, from the Bible to the Black Panther, has specific elements to it, right? There's a character, which is possibly us or the person that's telling the story. And then there's a challenge that that character is actually going through. There is a choice that the character is making, right? And then there's the outcome based upon that choice. So let me give you an example. Just in preparation for this webinar today, what if I said to you, I woke up, I got out of bed, I got dressed, walked into my room office, turned on Zoom, and like, here I am. Like, does that sound like a story to you? Cassandra, maybe you can come in with me for a moment, and help me out with this. Hello.
Hello.
Hi. So I'm wondering, is that a story that I described to you?
No.
No. What's missing?
No details. It's just boring. You got up and you went to the Zoom camera.
Okay. So
yeah.
well, what if I said, upon awakening, and before I stepped out of the bed, I began to hear this funny noise, right? And I looked down, and the floor is filled with spiders, right? The floor is filled with spiders, and I'm like, whoa! I stop, I hesitate, I immediately grab my cell phone and begin to play gospel music, right? And suddenly, for whatever reason, the spiders begin to separate, and they allow me space to get up and walk from my bed to the bathroom to shower, right? And then bring me my clothes to put on. Like, what would you think then? What does that say to you?
I'd be like, wow, did that happen?
But I think but the point is, right, what does it demonstrate? Are you able to
I can kind of visualize what you're saying.
So details, right?
Details, yes.
Right. And so at the same time, are you able to identify maybe what my values are in that moment?
Yes.
Thank you.
Yes.
Okay.
Yes.
All right. Thank you for helping me out. So I want to go to next slide. And so what in me telling that story and listening to Miss Cassandra, we're to zoom in a bit. When you listen to the story, again, it will elicit certain emotions. Some will prevent us from acting. That means inhibit, and others will allow us agency and opportunity to move forward. And those are motivators. The point of us telling a story, or our story, is to raise our values that lead us to a space of action for ourselves, our community, and our organizations. So when we talk about freezing, right, some that will cause us to freeze. And when we look to the left side of our screen here, um, things such as inertia, um, apathy, fear, isolation, or self-doubt can put us in a space where we don't like, we're like frozen and we don't want to act. On the other side of that, to motivate when we are telling the story, we're looking to create a sense of urgency for ourselves, for our colleagues, and in this case, as healthcare professionals, for our patients. Anger, and we're not talking about righteous anger, or excuse me, not righteous anger, but like anger where we're just like it's not positive or beneficial. We're talking about outrage, and that's typically at an injustice that has happened that we're looking to try and respond to. We're looking to create senses of hope, right? And solidarity again among ourselves, our colleagues, and our patients. And then this acronym that I love to say for some reason, ICMED, which means you can also make a difference. Basically, looking for us to be able to find agency in these moments to become active and make change in our spaces. So when you reflect on these, are you able to identify at all, Cassandra? And I think I see Erica there.
Yes, we're doing an outreach actually.
Great.
Yeah, a sense of urgency to get out of the way so them spiders can get out your way. Yeah. Angry on how they got there.
Right, but what about a sense of, not even in that story, like how
Okay.
have you identified with maybe senses of hope when you've heard a story presented to you in the past? Like can you identify with that?
Yeah, lets me know that if whoever's presenting that space to me, that if they've made it, then hopefully I can do the same, learning from what they've done.
And so, really what the motivators are looking to do is they're teaching us to really to respond in the moment to whatever the immediate crisis of our people is, and to not react, which is what some of the inhibitors would allow us to do. So what we're going to have for you next, we're going to move into a short video of Amy Staley, and she is going to share a narrative with you, really. And what I want you to do when listening to Amy, she is a staff nurse at New York Presbyterian and West Cornell Medical Center. When you're listening, I want you to see if you can identify spaces of urgency, or maybe anger and outrage, or where do you find solidarity, and possibly in listening to her, and just hoping that we'll be able to come back and have a short debrief around maybe what you found her values to be, and what the moments of hope were that she uplifted as she spoke. So I'm going to go on mute for the video is about 5 minutes, and we'll go ahead and play this for you. The sound is not on.
No, and I think you need to share the sound because you have your slides are without the sound probably. So you need to share the slide again with the sound this time.
Give me a second.
We will be right with you.
Thank you so much, Francesca. It is March 1998. My father lays in bed preparing to endure an unfathomable battle with cancer. He is a warrior, a fighter, and my mom is a lover, so she tucks him in with a warm blanket. She closes the door and tells me to count the red and black speckled ladybugs crawling across the doorknob. I notice his favorite book, Into Thin Air, a book about a group brave enough to climb Mount Everest. Some make it to the top, some run out of oxygen along the way, but I'm 5 years old and can't read, so I continue to count the ladybugs. 1, 2, 3, and he's gone. My mother hugs me. I feel safe and secure, and she is not a nurse, but she is a healer and a giver. And it is because of her selflessness and sacrifice over the next 13 years of my life that I make the choice to become a nurse. I get into nursing school and pick up a job working with pregnant teens in foster care. They don't have mothers or homes, and many hold extensive criminal records, but they do have Miss Amy. And Miss Amy is both a lover and a fighter. And she speaks to them like they are the next world leaders because she knows that they are. She teaches them how to dress and speak respectfully, make resumes, and land jobs. They were by my side the day that I received my dream nursing job at the #1 hospital in New York. I looked at one of the girls and said, "When a door looks closed, all you have to do is knock." She told me that she was going to be a nurse too, and today she is. I began working at New York Presbyterian, where the sun shines every single day and miracles multiply by the minute. I am a proud nurse, not an Olympic gold medalist or an executive member of anything, but I am faster than Usain Bolt when crisis hits and the CEO of tucking you in with a warm blanket when the chaos has subsided. It is March 13th, 2020, and I am writing my name and the date on a brown paper bag to store my N95 mask. What I thought was a virus is turning out to be a war, and I leave my shift and walk to the hotel where I'm staying, but this time I'm not counting ladybugs. I'm counting refrigerator trucks. 2, 4, 6. I close my eyes and imagine that I'm at the top of Mount Everest. I open my eyes and see the bare streets of my city, wondering if we have enough oxygen in this country for a city of 8.5 million people. Then the silence breaks. It's 7 p.m. and the streets of New York are empty, but so loud, singing songs of hope and gratitude. People here across the Hudson River, across the world, are gathered on balconies, screaming from windows and rooftops in applause for frontline workers. We all came together to fight. Where were you? Finishing up a 12-hour battle of your own, working from home, or perhaps waiting in line behind 68 people just for toiletries. When the COVID-19 vaccine arrived, I was overwhelmed with hope, expecting songs of humanity, but instead I saw division. Many have forgotten that we are still battling a war with this virus. When we are floated to the COVID units in the United States, it is not called floating, but rather deployment. I will never forget when our first COVID vaccines arrived on Christmas Eve, seeing the hope in my colleagues' eyes as I had the privilege of vaccinating the same nurses who I watched care for those who you and I love so dearly, witness trauma and heartbreak over and over again, take only 8, 10, 12 seconds to breathe before resiliently grabbing that brown paper bag and walking into the next room to say, "Hello, my name is Amy, and I am so glad to be your nurse tonight." I know that hospital walls across the world cannot speak, but if they could, they would tell you that the time to act is now. I have spent the past month in a virtual room with 5 other nurses across the world discussing ways to increase vaccine equity and adherence. Not 6 feet apart, but rather worlds apart, we have discovered our most powerful weapons, our voices. I call on each of you here today to speak up. If you have already received the vaccine, I ask that you visit my website, frontlinefriends.org, to see how you can join me in painting a clear picture to both my city and yours about the difference that we can make. If you have yet to receive your vaccination, I urgently ask that you go out and get it now. It's not about an injection, but rather caring for the humanity of one another. Start in your communities and remember that if a door looks closed, all you have to do is knock. Let us spark hope before we return to silence. It's 7 p.m., and I hope that you hear my voice, counting down the moments until we join together. Unity begins in 3, 2, 1.
It doesn't matter how many times I hear Amy's story. It really draws me in. And so I want to invite um, our community in today just to really talk about or share any, are there any moments that resonated with you as she spoke, Cassandra or Erica?
Yeah. The dump trucks that she was explaining.
Like Erica, how did you, like, what emotions did that bring when you heard her talk about the dump trucks?
It brought sadness to me because a lot of people lost their lives during that time. Um, so I can clearly remember seeing those trucks on the news. So it was just like kind of like a flashback of what we were going through at that time.
And in that sadness, we're able to find some sort of solidarity in the common, a common struggle almost, dealing with what was in our present. How did you hear the sense of urgency, or how did she describe that?
Like to now it's time to act. You know, first I want to just think about how she was brought up. You know, she was brought up in a caring family, a loving family. So a lot of that resonated onto her to allow her to be that compassionate and caring person to pass on. And a lot of times it takes that building of whatever family looks like to you to move you to that next step of caring or walking away. And I could think about um, you know, the things that we were going through at the hospital and, trying to figure out what's going on. We didn't know what was going on, but we were trying to, get the proper leadership. It was changing every day, changing every minute. Personally, I didn't feel safe, but as a leader in the community and as a leader in my the job that I held, I had to hold it down for my coworkers or for my employees. Um, yeah, it was really an emotional roller coaster. Trying to, when I felt like I was worried, I couldn't let worry be on my face because then that caused the people that I was leading to be worried too. So it was more of just like, okay, we just gonna wait. We just gonna see how this thing gonna roll out. But in the meantime, this is what we need to do to practice safety. If we can practice safety, then we can help our community and where we live, breathe, and see people. So truly emotional. She brought you into the story, and she really caused you to think about what was going on in your life during that time. So
Thank you so much. For me, I don't think there's any question about what she values.
yeah,
Like there was a thread throughout, and I appreciate you uplifting the value of stories and the way that we are brought up with them, and begin to model them. Without even realizing it, and how it makes us, like who we are. And you also described something for me that we spoke about, and that is that leadership component, right, of enabling others in that face of uncertainty. And so I hear Amy, how she expressed that, and how you and me being able to know what the struggle really was. And so I'm wondering what we would like to do now that we've listened to Amy sort of model, not sort of model, but model what public narrative is and how it can affect us in the moment. Next slide. If we could, get on the bike a bit, and I would like to maybe ask you, Cassandra or Erica, I don't want to, pinpoint, but say, how much how many opportunities do you have within your current job to actually tell your story?
Several.
And if you could share a bit, like, you know, and I would just add to that, like, in telling your story, you know, what brought you to healthcare or health activism as a leader in community?
Personally, I think I was just wanting the community to do better or caring for others. Just always wanted to lend a hand when someone was in need for me.
So if I can ask you, Erica, like, but where did that come from?
The way I was raised.
The one. So in coming up, there were some values instilled in you that you carry forward into community. And that I'm understanding you're sharing with others now through your story and in the work that you do.
Absolutely.
Thank you. Thank you so much. Ms. Cassandra, if you will, what brought you to healthcare or health activism?
It just really just was probably already embedded in me, watching my seniors not caring for themselves and seeing the results of not caring for yourself. And then later on being introduced to others, giving you that opportunity to share your story. It's almost like, you know, you don't know you have something until somebody, you know, builds it up in you and it's there. You just need somebody to pull it out of you. So watching others live a different lifestyle made me do a change in my lifestyle to be able to help others in the community as well.
Can you describe maybe that moment of hope that you found, that where you were able to find that agency to say, like, I can do this, I can make a difference? Was there a specific moment that happened for you?
Yeah, probably when I first moved here in the Niagara Falls area. I had a colleague at the time that always was moving toward just building people up. And later on, you know, she took a lot of her ambition and values and, you know, helped build what we know now, which is the creative of Healthier Niagara, that really pushed others to, you know, to take accountability or just taking action in what they want to see in their own communities. And so being a part of that group really kind of helped. She helped bring out some things in me that I really didn't know by pushing me to do things, you know, speaking engagements and telling my story, or, you know, how do you get a screening, or how do you access healthcare, the healthcare system and things like that. So I was able to take that information and pass it on to those in the community so they can be able to access healthcare and learn too.
So, but like before working with this colleague, like, were there moments in your upbringing that you saw, like, or that you found, like, what was that like for you coming up? Maybe I'll ask
Well,
it that.
my mother always said that I never met a stranger. So it was like I was always wanting to know about somebody, especially if they wasn't well or they didn't look good. You know, I was always that one that, hi, are you okay? What's going on with you? So maybe I had the empathy, you know, of expression growing up. So, and watching my grandmother them do that as well. So I guess just like Amy was saying, those values that she saw her mom taking care of her father and all of that stuff. Sometimes it's just in you, you know.
So that's great. So it's like safe to say that the values that you experienced growing up gave you a sense of hope to really carry yourself through and into the work that you are in today. And now you share that through your work and outreach and education, sharing your story and that of those that you have encountered to help motivate others into a space of being advocates for themselves.
Yes, that would be safe to say.
Thank you so much. Thank you so much for getting on the bike with us. We really do appreciate it. And so like that is, we talked about the two ways of thinking again, right? The logical, the how we do, and then the emotional, the why we do. And I think this was a fantastic way to understand how those two pieces connect and move us into a space of being active organizers in our community, although we are not calling ourselves that. Let's move to the next slide, please. So as we begin just to close out, we just want to uplift, right? Story of self. Remembering and trying to really just hone in on what our public narrative first is not, right? And that is not a chronology, a resume, speech, or essay. Like we really want to be able to find that emotional space with which we can tell our stories and really share ourselves with others so that we're able to build a sense of hope and capacity, again, for our colleagues as healthcare professionals and for the patients that we work with in service. It is about moments and the plot of the story, right? So again, we are the character, or the individual that's actually expressing their story is the character. And there is a challenge, there is a choice, and there is an outcome. And those are the three elements that will be attached to your story as you begin to craft this, if you take this journey with us, to know that you are, being able to really be explicit about yourself. Show, don't tell means that, like, me getting out of the bed, getting dressed, and getting to the Zoom room, it doesn't tell anything. It's not about details or any of that. We need to be able to share those moments, articulate them out loud, and allow people to hear and understand what we are and why we're doing what we're doing. Really try to dig deep in on that origin moment. Like, what causes us to act and move? Where is the hope and urgency coming from? And typically it was a situation that we may not remember until prodded sometimes, which again is, we can get more into later on. Values, being able to identify our values as we speak to others. And it really allows them to understand us. And then one of the most important things when we share is being able to be vulnerable, right? And I'm not saying we tell our deepest, darkest secrets, but we're sharing enough that we can begin to understand and identify each other as community. And once we can do that and we're understanding each other and we know what our goals are and what we're striving to do, it coalesces sometimes and gets us to that great space. So I want to just get to our next slide, and we want to close out. So what would we like? What is the hope of this health community? We want to invite you to join us for our upcoming webinars. First will take place July 22nd at 3 p.m. And this will be how can you build relationships from power, meaning move from the lone wolf activist to a robust community. And two, on August 2nd, which will take place at 5 p.m., is what is your activism strategy and how do we shift power in order for us to win? So Nevina, if you will, we have registration links that we will drop in the chat for you. To, if you choose to join us, and obviously the in the larger view, we are hoping that you come on board with us for the Heart program, which will begin in October. I want to ask, and I missed this on my own, and I'm sorry, like, what are you taking away from today? Like what is there anything that resonates with you that you'd like to uplift? Share a statement, anything that, just as you leave us today, what have you taken from, this few moments that we've had together? And you can feel free to unmute if you will, or drop in the chat if you cannot.
Same thing.
So kind of hearing, and I don't know if it's for us.
We're strategizing here.
Okay.
She's saying being mindful of where people are.
As far as like the social deterrence.
Social deterrence.
Sometimes some of that stuff has to be met first before you.
It sounds like she's talking about meeting people where they are, and are we doing that through our storytelling?
Yeah, so kind of meeting people where they are socially in the social determinant areas, so that way when you meet them there, you're able to lead them somewhere else, if that makes sense. Like you take care of this portion so they can be healthy to make the next move. That kind of what you mean?
Yeah.
Kind of sort of like that.
Next right step, identify and don't compare.
There you go.
Okay, thank you. Listen, again, we are at time, so we want to be mindful and respectful of that. We at People Power Health just want to thank you for joining us on today. We really appreciate you being here and hope that you're able to come back for our next webinars. Again, first will take place on next week at 3 p.m. and then the week following at 5 p.m. And the links were dropped in the chat for you. So with that, we bid you adieu. Peace and blessings.